Hello, my name is Nicholas Donin, and I am a urologist at UCLA Health. And today we're going to talk about transperineal prostate biopsies and specifically freehand technique for transperineal prostate biopsy. So just some background, I've been in practice now for about 8 years, and I started doing transperineal prostate biopsy probably about 6 years ago. I was doing a lot of prostate biopsy as part of my practice. And, this was about the time where there were increasing concerns about issues related to transrectal prostate biopsy. And there was increasing interest in transperineal prostate biopsy and particularly freehand techniques for transperineal prostate biopsy. And so I decided that that was something that I thought at least theoretically made sense perhaps for me to incorporate into my practice. And this really started to kind of become real when I had a couple different patients who I felt would be best served by having a transperineal prostate biopsy. One of them had a prior episode of sepsis from a transrectal biopsy, and so certainly that was a case in which that patient really was not willing to, and it would not be reasonable to do another transrectal prostate biopsy. Another patient was a gentleman who had a very large prostate and a very, very anterior lesion in his prostate that I had done a transrectal biopsy on. And because of the location of this lesion on his MRI, I was concerned that we had not been able, from a technical standpoint, to get very good sampling of that area of his prostate from a transrectal approach. And I felt that that patient would be best served by having a transperineal biopsy. And so I was sort of seeing increasing numbers of patients where I felt like a transperineal prostate biopsy was the right thing for them. And so that along with the sort of rising tide of voices, talking about transperineal biopsy as something that we really needed to be thinking about doing more and more, was what kind of spurred me to adopt transperineal biopsies in my practice.